Hi everyone, my name is Amanda. For about a year now, I've had a lot of symptoms, all involving mostly my eyes. Um, about a year ago, I started to have trouble like looking laterally, side to side, uh, like that, where I couldn't focus when I was doing it. Um, it was in October of 2011 that I was on my way home from work and I got double vision when I was driving on my way home. It was scary. I was on birth control at the time, so I was thinking, a blood clot in my eye, an aneurysm, all sorts of horrible things. And I went to the emergency room. They gave me a CAT scan. Nothing came up clear. They blamed it on sinusitis. They said because I had a mild cold that I was getting double vision and that it would go away. Well, it didn't. It went away probably about 3-4 days after the first onset, and I was back at work doing all this other stuff, and it started again. So I took a medical leave of absence from work to try and figure out what was going on. I saw an ophthalmologist, an ophthalmologist, and a neuro-ophthalmologist. The ophthalmologist said that he couldn't see anything wrong with my eyes. He wasn't sure why, but after my visit to the emergency room, he agreed, said it's probably just the sinusitis, just pushing, the inflammation just pushing on the muscles and stuff that direct and move my eyes, and that was causing the double vision. Well, it went away again, and it came back again. So I went to see an ophthalmologist, and he had told me that he wasn't sure why. Honestly, he had no idea. He said that my eyes looked fine. I have 20/20 vision, all this other stuff, which is ironic considering I'm wearing glasses. But they have prisms in them to kind of help deal with the mild double vision when I have it like I have it right now. The ophthalmologist I saw suggested that I could have had a very, very minor stroke. Something that wouldn't have shown up on a CAT scan, that could, be invisible even on an MRI. But that was causing that muscle failure and everything else. But he referred me to a neuro-ophthalmologist, and they went through all of the same tests that the optometrist and ophthalmologist did, checking for glaucoma and looking into my eyes and checking my peripheral vision and all of this other crap. And he said nothing was wrong with me. I'm pretty sure he felt that I was making it up. He told me that he was pretty sure this would eventually go away on its own. When I asked for a time frame, he said, I don't know. So it was after that it was around Christmas time at this point, and I lost my job. So I lost my insurance. I lost a lot. And I am still undiagnosed as to what's causing all of this. After doing research on my own, I'm pretty sure that I've developed, or I have something called myasthenia gravis. The reason I've come to this conclusion is because just recently, within the last few weeks, a new set of symptoms has come on. And one thing I looked at when I was looking at pictures of myself was my smile is different. Like the muscles in my face aren't working correctly. I've had minor trouble, swallowing. I always have to have a liquid or something to drink to help wash everything down, or else I will choke. There's no ifs, ands, or buts about it. And my left eyelid, as you can see, droops a little bit when I have a lot of eye fatigue and everything like I have right now. But I have no insurance. I have no way to properly diagnose myself, but I'm pretty sure it's what I have. Reading the symptoms and the onset and everything of it was like reading my life for the past year. And I haven't been able to look laterally, side to side like this, without seeing double, even with my glasses on. I'm looking this way. I can't even look directly at the camera. So I don't know if it's just affecting my left eye or what it is. but I've had this condition for about a year. And after seeing so many people, I went to YouTube and I watched video after video of people who are struggling with this disease and having it, and I just wanted to get that out there. Myasthenia gravis, as I've read and as I've heard, is one of the most difficult things to diagnose for people because the symptoms vary so violently. I went weeks without any kind of trouble with my vision. And they call that being in remission, where the symptoms just fade away. But it's a neurological disorder. It's something that affects the brain, where normally when you want to move or speak or swallow or do anything, your brain will send that message to that muscle group and you'll just automatically do it. Myasthenia gravis blocks that somehow. Like it doesn't want to communicate. So basically with me, what's happening, I believe, is the muscles of my eyes aren't working together like they should because they're trying to. My brain just can't send that message to those muscles. But misdiagnosis often happens, especially with ocular myasthenia gravis, which is, I'm pretty sure, what I have. I don't have any other weakness in my muscles or trouble breathing or anything like that. It just seems to be affecting, the skeletal muscles and stuff like that, which makes me very, very lucky because there are some people that need to be on respirators and everything else that have this disease. But in the end of the day, I need to go get diagnosed for it, and I need to find treatment for it. So hopefully, life will be kind to me in the next few months, and I can get the help I need. But if anybody out there is having trouble or anything else, and they keep having doctors tell them there's nothing wrong with you, it'll go away on its own, or maybe it was a minor stroke, or we're going to do a CAT scan and an MRI and there's nothing there. Even with ocular myasthenia gravis, there's a blood test that they take where they detect for something. I don't remember exactly what it is. But with people with ocular myasthenia gravis, 50% of the time it comes back negative. And I believe that's what happened to me. But they will tell you all sorts of things. But if you're having double vision that comes and goes, if you're having muscle weakness that comes and goes, if you're having trouble swallowing, a whole plethora of things that just doctors are telling you that there's nothing wrong with you, check into myasthenia gravis. Don't go through what I've gone through and losing my insurance and having no way to get help right now for this problem. But don't give up. Be strong. Things happen for a reason. And even if this is what I have, I'm not letting it hold me back. I'm a college student. I'm going to Full Sail University online for a game design degree. I love game design. I'm absolutely in love with it. And I'm not going to let this hold me back or destroy my dreams or anything else. I'm going to take charge, and you should too. So, just trying to get the word out. If you have similar experiences as me or anyone else, look up myasthenia gravis. Look it up. Check out YouTube videos of people talking about their experiences with it because it is so hard to diagnose, and you will hear people having this just horrible experiences trying to get help. Far worse than what I've gone through. So don't be afraid to ask for help. Don't be afraid to do research, and don't be afraid to push and say, you know what, these are my symptoms. They're not going away. I'm not crazy. I'm not just looking for an excuse, or it's not all in my head, because I've been told that too. So don't be afraid. Just go get it. Thanks for listening.